Hi everyone, this is Dr. Kusuma from Suria Plastic Surgery. It's been a fantastic morning for me this morning because I'm seeing great post-op patients, which is a joy for me to see because the journey of surgery has ended and we've accomplished almost everything that we want to accomplish, and so the plan and the execution and the phase of recovery has gone well, and it gives me great joy to see patients back for their post-operative visit. So another patient came this morning and I wanted to take this opportunity to talk about this patient as well. So first, let's zoom in on the picture up there on the screen. I want you to see the before and after picture up there on the screen. And I'm using our Simplast software technology to demonstrate this on video and on photos here. So if you notice this patient on the left, that is the patient that's sitting in front of me. That was about 2.5 months ago. And this is her today with very little to no makeup. A slight touch up here and there, but no embellishment, no photoshopping, no editing. And she came in after about 2.5 months of healing approximately. And so how do you feel about this?
I'm thrilled.
Do you recognize that person on the
I forgot how bad it looked before I came here.
It's amazing what 2 months can do, right?
Yeah.
And another interesting thing that I noticed, if you zoom in on her, I want you to notice, I distinctly recognize today the type of clothing you're wearing. You look confident. You're wearing a sleeveless dress, and it's South Florida, obviously. You're wearing a necklace to highlight and draw attention to your neck. Mm-hmm. And you look like you're happy and proud. I mean, because I mean, that tells a lot, right? Because in this picture, we took out the necklace for the impact of the photo, but in real person, this is how you came.
Yes.
So how did you feel when you got dressed this morning to look like this?
I felt great. All that excess stuff was gone, I'm thrilled. It's like 100% improvement.
Yeah. So happy to hear, because it just puts a smile on my face, honestly, when I just walked down and saw you. And I said, is this the patient that I'm looking to see today? What amazing. So tell me, you looked, a little bit like that, where you felt, just things are not what you want. And what finally motivated you to do something about it?
Because I couldn't stand it any longer. I wanted to look better.
And then did you talk about this with your family, or is it your own solo decision? Did you get support from family?
Well, I talked about it with my husband, but it was my decision. I knew I wanted to do it. I wanted to do it for a long time. And I saw pictures on Facebook of some of your results, and that's what drew me down here.
Mm-hmm. And then where do you live in South Florida?
An hour and a half away from here. I live in Stewart.
Okay. So it's a little bit of a drive for you. But we're so happy you came to visit with us. So we had a consultation, kind of like what we're doing now in a sense, and we talked about a bunch of stuff, and I recommended to you a few things that you should consider doing.
Right.
And did you think it was too much to do, or did you were just mentally ready to do whatever you want?
No, I didn't know that I would ever do it again. So I wanted to get everything done that I wanted the first time. Mm-hmm. I know it's a longer healing time potentially, but I wanted it all done.
Right. So just again for the audience, the recommendation that I made to her is, to improve, if you focus in on here again, the entire neck, there's so much excess tissue and excess fullness of the neck. There's no definition of the jaw and the neckline here. These lines, we can't do a whole lot about, because that's going to require a long-term skincare process, so we didn't do much for that. There's eye issues on both upper and lower, and generally there's just no good structure to it. So what I recommended, if you notice here, now you have a jawline, the neck is gone, and there's a depth to it. You can define, again, like I said, this area we couldn't do much, but even that is better compared to before. The lower lids, the fat bags are gone and it looks very natural. The position of the eyelid is very natural. It doesn't look like it's healed improperly. The upper eyelids are more showing. You can see the distance between the lashes and there, and the shape of the face has a nice structure to it. And so I recommend it to you in surgical terms, what we call a lower face and neck lift surgery. I had to do a lot of open liposuction in addition to that as part of the surgery, so it was extensive. I did tightening of your deeper muscles to kind of give you the shape that you wanted. And we did a lower eyelid blepharoplasty, and we did an upper eyelid blepharoplasty, and we also did a tiny bit of fat grafting as well, right? So it was a long day. And so how was the surgical preparation for you? Did you feel ready for surgery? Did you feel like you had your questions all, your husband and you felt like comfortable with it?
I did. I asked all my questions beforehand, and I was so ready to get it done. There was no doubt or hesitation on my part. None.
And the surgery recovery, surgery took 6 hours, something like that, and we did it under IV anesthesia, so no breathing tubes, no hospital admissions, no overnight stay. We basically give medicine through the IV, and we do it in our office in our accredited operating room, and we sent you home the same day. So how was your recovery process? I think talk to us a little bit about pain, eating, sleeping, and be honest about it. Just speak exactly like how you felt.
Well, there was virtually no pain. I have to say that.
But people would find that hard to believe.
But it's true. And it does take a little bit for the swelling to go down. But
you must have a very high threshold for pain, because I've interviewed other people who also have had surgery like yours, and they've had difficult time for the first 3-4 days at least.
No. Advil pretty much did what I needed. I didn't really need prescriptions. And
did you sleep well? Were you able to get a little rest?
That was the only thing. Well, I was when I eventually started sleeping in the recliner, and that was much better. I was able to do that. But internally, I had my days and nights mixed up for about a week, because I slept most of that day that you did everything. So I had to retrain myself to sleep at nighttime. But other than that, no.
Eating, drinking wasn't a huge problem?
No.
Walking around the house and doing, was
no.
okay? And then how long did it take you, for you, mentally or physically, to feel okay about how you looked?
As soon as the black and blue went away and I could see some of what you did, then I was happy.
How long did that take approximately? Do you remember?
A couple weeks, maybe not quite, for the more obvious things. I am still numb in a few areas, but it doesn't hurt.
And then I do remember you went out of town, for about a month or more, right after surgery.
Yeah.
And we did virtual video follow-ups and exchanged some photos and here and there, and did some video consults through our Simplast app. So how was your journey to where you went? How was your recovery process there?
It was fine. We flew up, and I still had some bruising, but I figured, don't look if you don't like it.
So you drove, you didn't drive, you flew?
No.
Okay.
We flew up.
And the journey was comfortable? Was it okay?
It was fine.
Yeah.
It was fine.
And then when you were, away out of town, where I don't physically have connection with you, you felt confident and comfortable with the healing and everything?
I did.
Yeah.
I had no qualms whatsoever.
And now that you're back, are you getting, what type of feedback are you getting from family and friends?
You look different. They don't realize that I had that facelift, but they do notice a big difference. And
then your husband, what is his feedback been? Because I do remember he's been very supportive of you doing this when I spoke to him.
Yeah, no, he once he realized I was serious, he said, "So you're finally going to get your facelift." But he was fine.
So for the audience, what would you say to people who are like you, thinking through things and considering various options? What would be your recommendation to people watching this?
Well, once you make your mind up and then you start your research, it's just a matter of finding somebody that you feel safe and secure with, and go for it. Just go for it. I am so glad that I did.
A private thing for a lot of people, and very understandably so. However, it's also great for very many good people who are looking for authentic information and looking for real experiences of real people that undergo this, not the made up glamorous, Photoshop versions of things that you see just for, just for glamour. This is real life. You're a regular person, live in a regular community, and that's what people want to see. Not this curated, not this embellished, versions of just for marketing purposes. And so I appreciate it. I do a lot of face surgery, and many people don't feel comfortable for obvious reasons to be, out in public. But I appreciate everyone who does, because you are truly helping a lot of people that you don't realize. I hear this all the time, Dr. K, like you said. You watch Facebook and you saw, and that's what one of the things that helped you. Similarly, many people watch these YouTube videos and they watch it with their family members and they kind of understand what happens before they get into it and they feel comfortable with it. So thank you from my behalf, my office's behalf, and thank you from the audience's behalf. But you absolutely look fantastic. You made my day
Good.
very, very good. I'm very happy, and I have several patients to see yet, but this is just going to give me much more energy to do what I do. But I love it. Thank you so much.
Thank you.
Yeah.